Welcome to the PACE Online Learning for Facility-Based Workers. If you work in your community, please refer to the PACE Online Learning for Community-Based Workers.
This module is about the A in PACE, which stands for Agitation and Aggression. As a healthcare worker, many of you have experienced violence in the workplace that resulted in injuries. Injuries caused by pinches, punches, scratches, bites, kicks, grabs, and other acts of violence from residents. Talking about a resident's challenging behaviors and violent acts can be difficult because these behaviors and actions are often not intentional. They can result because your resident has an underlying medical condition that is beyond their control. Think of a resident's agitation and aggression as the tip of an iceberg. You need to look at what's beneath the surface. Many residents who exhibit violent behavior suffer from a cognitive impairment. These impairments can make them resort to challenging behavior when they experience unmet needs. Unmet needs may include experiencing pain, hunger, thirst, low energy, or the need to use the washroom. Perhaps they are tasting, smelling, or hearing something unfamiliar. Sometimes they are just feeling generally uncomfortable. In addition to unmet needs, unrecognized triggers can also be responsible for a resident's challenging or violent behavior. Unrecognized triggers can be more difficult to detect. That's because even though you're doing everything correctly as a care worker, the triggers may consist of things that are much more subjective and difficult to address. These can include things like wearing your hair differently, or that you wear glasses. It could even be the tone of your voice, or your gender. Because some triggers can be difficult or impossible to address, great care must be taken when assessing a resident's likelihood of violent behavior. To do this, we must pay careful attention to the resident's verbal and nonverbal cues. Verbal cues can include the resident's speech patterns, such as tone, volume, and language choice. Nonverbal cues can include things such as threatening body language and expressions, or a refusal to communicate at all. And most importantly, you need to acknowledge the resident's personal history of challenging behavior. As with all PACE components, using this assessment technique will help you determine if it is okay to proceed with caution, or stop and get assistance. It is okay to proceed if the resident isn't agitated or aggressive, and this is not expected to change, as they do not have a history of challenging behavior. You need to proceed with caution if the resident has a history of challenging behavior. This means they're unpredictable, even if they don't seem agitated. If the resident is exhibiting mild forms of challenging behavior, but risk is not imminent, it may be time to use your training to determine if they have any unmet needs or are experiencing an unrecognized trigger. If the resident is exhibiting signs of agitated or aggressive behavior, it may be time to stop and get assistance. This is when you should find a safe place to contact your immediate supervisor to determine next steps. Healthcare work is changing. The people you care for are older with more complex and challenging health issues. This is the reality, and we can't change it. What can't continue being your reality is suffering injuries at work due to resident agitation and aggression. By using PACE properly when assessing your residents' behavior, you can help ensure they get the care they need, and you can get home safe to what matters most.
Please click below to complete the quiz before continuing on to the next video.